I'm Dr. Rajesh Upadhyaya. I'm a Senior Director and Head of Department of Gastroenterology at the Max Hospital. And currently, I'm the Organizing Secretary for the mega event APICON 2024. Mega event which we are doing, the APICON 2024, is the 79th annual conference of the Association of Physicians of India, which was formed in 1944 by 8 physicians in Chennai, and the headquarters then moved to Mumbai. Over the years, the numbers have swelled from a handful of doctors to now more than 22,000 postgraduate physicians of this country. And in this conference, about 10,000 physicians from all across the country and 30 to 35 international faculty are all having deliberations and lectures in here. The conferences have gradually evolved over the years and has grown to an extent where this has become I would call it the major physicians get together in the country for evolution of their knowledge, and it's a great place for networking between doctors, developing relationships as well. So we also call it the Mahakumbh of physicians. And the typically like Mahakumbh, you will see all shades of it, all topics are discussed, ranging from cardiology, gastroenterology, rheumatology, neurology, all the subspecialties are discussed. But especially, we are taking care of discussing the contemporary topics now. What is the role of artificial intelligence and how is it going to affect the physicians tomorrow? What is going to be our impact of pollution on our health? The impact of climate change on our health? What about the toxins and the rising incidence of cancers all over the world and in India as well? All these are issues which are being discussed. So, artificial intelligence is one area which we feel is going to probably change the medical practices in many ways. It is not that the artificial intelligence will stop the need of doctors, but certainly it will have a major impact in the diagnosis and treatment of diseases. The pollution is having a major impact on the health of individuals, and this massive increase in prevalence of cancers throughout the world is somewhat related to pollution itself. There is now a growing evidence that the pollutions in the Gangetic basin and maybe adulteration of mustard oil may be attributing to the massive increase of gallstone disease. Similarly, various pollutants have been identified as contributing towards increasing incidence of colorectal cancers. So we have a large number of evidences coming in. As far as the general health is concerned, it is also being noticed that the gut bacteria and the gut flora determines the health of the individual to a large extent. And it has been shown in various studies that people, for example, with diabetes or hypertension or fatty liver have a different type of gut flora compared to normal individuals. So clearly, the gut health is determining to a large extent and showing its impact on the individual's health overall. What we are seeing is that the climate change which is happening throughout the world is also taking its impact on the human health. And the number of enteric diseases which we see now in specific months with temperatures are higher is certainly rising, and this is something which we have to worry about and take care in future.